Hi, I'm Kyle Malone. In this video, I'm going to talk to you about the primary muscle groups of the torso that act on the spine. Muscles play a major role in the body. They produce movement, maintain posture, and stabilize joints. Muscles attach to bone by tendons. They are enveloped by a thickened connective tissue called fascia that helps reduce friction as the muscles contract. Muscles of the torso can be segmented into anterior, anterolateral, and posterior muscle groups. Let's begin with the superficial anterior and anterolateral musculature, also known as the abdominal muscles or abs. The rectus abdominis muscle is a paired muscle running vertically on each side of the anterior wall of the abdomen. The rectus abdominis is an important postural muscle. It is responsible for flexing the lumbar spine, as when doing a so-called crunch sit-up. It also assists with breathing and plays an important role in respiration when forcefully exhaling, as seen after exercise. The external oblique is situated on the lateral and anterior parts of the abdomen. The external oblique functions to pull the chest downwards and compress the abdominal cavity. It also has limited actions in both flexion and rotation of the vertebral column. The internal oblique is layered deep to the external oblique. Its fibers run perpendicular to the external oblique muscle, beginning in the thoracolumbar fascia of the lower back. The transverse abdominis is a muscle layer of the anterior and lateral abdominal wall, which is layered deep to the internal oblique muscle. The transverse abdominis helps to provide thoracic and pelvic stability. This muscle is vital to back and core health and also has the effect of pulling in what would otherwise be a protruding abdomen. The quadratus lumborum is a muscle of the posterior abdominal wall. It is the deepest abdominal muscle and commonly referred to as a back muscle. It is irregular and quadrilateral in shape and broader inferiorly. The quadratus lumborum connects the pelvis to the spine and is a common source of lower back pain. The psoas muscle arises from the lateral lumbar vertebral bodies, starting at L1, blending together as more insertions are added from each subsequently inferior level. For this reason, it is thickest at the lowest lumbar levels and then tapers and projects more anteriorly to travel through the pelvis to attach on the femur for hip flexion. The iliacus muscle is found in the lumbar region and is covered in a thick fascia or connective tissue. This muscle is shaped like a triangle, is flat, and an exact fit of the iliac fossa, the curved surface of the largest pelvic bone. The iliopsoas refers to the joined psoas and iliacus muscles. The two muscles are separate in the abdomen, but usually merge in the thigh. As such, they are usually given the common name iliopsoas. The iliopsoas muscle joins to the femur at the lesser trochanter and acts as the strongest flexor of the hip. The lumbar plexus also passes through the psoas muscle. The lumbar plexus and the psoas muscle will be discussed in greater detail in future modules. Now let's move on to the posterior muscle groups. Posterior muscles are further divided into superficial, intermediate, and deep layers. For the purpose of this video, we will just focus on the intermediate and deep layers. Within the intermediate layer is the group of muscles known as erector spinae. The erector spinae muscles lie on either side of the vertebral column, running from the lumbosacral area superiorly to various insertions along the ribs and up to the base of the skull. They extend the entire vertebral column and help to maintain that normal curvature of the vertebral column. There are three erector spinae muscles: the iliocostalis, which originates from the iliac crest and ribs on each side and inserts onto more cranial ribs and transverse processes; the longissimus, which originates and inserts along adjacent transverse processes of the entire spine; and spinalis, which originates and inserts along adjacent spinous processes of the entire spine. The deep muscle layers help to support posture and assist the intermediate muscles in moving the spine. The deep muscles are smaller than erector spinae muscles, and none of them traverses more than 6 vertebral segments. Of the deep muscle layers, the multifidus muscle is commonly referred to during spine surgery. While very thin, the multifidus muscle plays an important role in stabilizing the joints within the spine. Located just superficially to the spine itself, the multifidus muscle spans 2 to 4 segments and works to stabilize these joints at each segment. The multifidus muscles originate at the facet joints and travel superiorly and medially for 2 to 4 segments and attach on the spinous processes. Dysfunction in the lumbar multifidus muscles is strongly associated with low back pain. And that's it. You now know about the primary muscle groups of the torso that act on the spine.